I rise to speak on the Voluntary Assisted Dying Bill 2021. Under the terms of this bill, assisted dying means a doctor or nurse providing the means for a patient to end their life, or if a patient is physically unable to do so, ending their term of their life for them. This means the bill seeks to legalise both assisted suicide and euthanasia in Queensland. Madam Speaker, changing the law to legalise assisted dying in Queensland will put enormous pressure on the poor and vulnerable people in this state, especially those suffering from some kind of life-limiting disease. The tragic irony is that while for the small minority the right to die represents choice and autonomy, for many thousands others it will eventually mean less choice and less autonomy. Elderly, sick and disabled people already suffer from the feeling that they are a burden to their family, carers and a society that is cost-conscious and short on resources. No matter how many safeguards you put in this bill, all of our vulnerable groups will inevitably feel extraordinary internal pressure to opt for assisted dying when the choice is presented to them. Their decision-making is also likely to be affected by depression, confusion and dementia. They rely entirely on their doctors for reassurance and guidance. The bill completely fails to take into account the enormous power and balance involved here, or the complexity of emotions that can influence people when they learn they have a terminal illness. Many of these patients may simply need reassurance from those around them, to hear that they are loved and that their lives have value and meaning, and to know that we are, as a society, are committed to their well-being, regardless of how much time, energy and money may be involved. Madam Speaker, the experience of all the other jurisdictions where these laws have been introduced shows clearly that even the strictest safeguards will over time be eroded. In some places like Canada, this has happened just a few short years. Between 2016 and 2019, 14,000 Canadians ended their lives using legislation very similar to this one. Over 3 years, the number of deaths using these laws jumped 30% every year. Last year, Canada's assisted death rate rose another 34% for 2020 alone. This means that between 2016 and 2019, the number of Canadians whose lives were ended under VAD legislation had a total rise of 124%. The same pattern has occurred in Belgium, Oregon, the Netherlands, Switzerland and all other nations and states that allow assisted suicide to take place. So regardless of what the proponents of this bill claim, the slippery slope of assisted suicide and euthanasia is very, very real. Now you have to look at the recent public hearings on this bill, where we heard many advocates for the laws complain about how the safeguards built into the Victorian bill were proving too restrictive and that not enough people had been able to get access to them. This was surprising, given that the Victorian government said at the time they were shocked at how many patients were put on the applicants list immediately after the laws passed, because the numbers were much higher than the proponents of the bill had led them to believe. The fact is, Madam Speaker, there are far better, safer and more ethical ways to help patients as they approach the end of life. Around 32,000 people die in Queensland each year, and the vast majority do so without the benefit of palliative care. Palliative care in Queensland has been scandalously underfunded and is under-resourced for years. As of January 21, more than 23% of Category 1 oncology patients on wait lists are there for much longer than the recommended 30 days. Palliative Care Queensland has said an extra $275 million per year is required. The government has only promised an additional $171 million over 6 years. It should be noted that they only did so to help push this bill a bit further, I believe. Either way, the funding is massively inadequate for the state, with a large ageing population like Queensland. In my own region, there's been a chronic shortage of GPs, not to mention palliative care specialists, for years in central Queensland. Mackay, which has had a population of 134,000, has had no specialist palliative care doctor at all. How can we even consider legalising this suicide, voluntary assisted suicide, when so many people are dying without the care they require, even without the option of receiving it? Madam Speaker, this bill will cause tens of thousands of vulnerable Queenslanders to become even more neglected and marginalised with our health system. We're already seeing it with the rampant use of unreported and uncontrollable liver-pill care pathway policies in some of our hospitals. Policy, I might add, that recently led to the allegations of mass killings going on in UK hospitals and aged care facilities and which are now the subject of a government inquiry. The clear message all this sends to these vulnerable people in our community is that anyone who has lost their capacity or health is living on borrowed time. Imagine the enormous pressure they will feel to consider it a day to make a room for those who are young and healthy and, most important, economically productive. This is why so many bioethicists warn that the laws like these can so easily slip from being about the right to die into a duty to die. The fact is, Madam Speaker, if this bill passes, every poor, elderly, infirm or alone patient will become subject to all sorts of obscene forms of coercion, a coercion that is powerful, insidious and absolutely impossible to detect. That's the problem. Another big risk I see with the laws is the way they will end up being used by governments, insurers and health policy advisors to impose limits on what forms of healthcare people should expect to receive in Queensland and for how long. This is where we come to the eugenic roots of this kind of legislation. In the US, laws like these are already being used, as little as more than cheap alternative treatment options for those with serious or long-term illnesses. One 50-year-old lady in Oregon has written of how she was offered assisted dying brochures by her insurance company while being denied expensive chemotherapy treatment for her condition. Let's face it, if you're overstrapped state with budget problems or healthcare insurance company looking to save a few billions during an economic downturn, these laws are going to be a godsend. We shouldn't gloss over that fact. Never. Nothing I heard or saw in any of the hearings dealt with this issue at all. The pressure will grow from many elderly and poor people or those with chronic lifetime limiting illnesses to opt for suicide to minimise costs and resources not only for the state but also for a lot of private profit companies such as aged care and insurance. And the bill is drafted in such a way where it will all happen behind a veil of state-sanctioned lies and secrecy. Under Clause 81 of the bill, doctors are instructed to falsify the public record by issuing death certificates that list the origin, disease or condition of the patient suffered, not the lethal dose that was the true cause of the death. The clause also requires those same doctors to blatantly lie to the patient's family when telling them how their loved one died. The level of deceit involved here is a clear breach of public trust on almost every level, Madam Speaker. The loss of trust between people and their doctors will be nothing besides the massive loss of public trust we will see and in the integrity and the truthfulness of all government, in their data, statistics and record keeping. I find the fact that family members are not even going to be told or consulted of what is happening before their loved one dies, or allow us to be with them at the end. That is shameful. I lost my grandfather, his spirit had flown, and it was the worst thing that ever happened to me. Even after the event, it seems that they will be told nothing. Claims that privacy is the reason for this is no more than a fig leaf. They say these laws are wanted and justified. If that's the case, then why is everything to be done in the secrecy and hidden away from the public and the families? I find it deeply disturbing. I'm convinced it will lead to serious abuses down the track and maybe many wrongful deaths as a result. I'm also disturbed by the fact that virtually no consultation was carried out with the Indigenous peoples and their marginalised group. Ultimately, the only safeguard that works is the one already in place, a blanket prohibition on killing. Thank you, Speaker.